Last year, Statistics South Africa reported that over 90,000 girls, pardon me, between the ages of 10 and 19 years gave birth between March of 2021 and April of 2022 across the country. Now, a new social behavioural campaign targeting children between the ages of 10 and 14 is being launched by the Social Development Department to help curb teenage pregnancy and HIV infections. For more on this, we're joined this morning by the Deputy Social Development Minister, Hendrietta. Bogopane-Zulu joins us via video link this morning. Hendrietta, it's great to see you. And certainly it is an incredibly important discussion we're having this morning. Those numbers, over 90,000 girls in the space of about a year from 2021 to 2022, giving birth to children giving birth to children effectively. Something needed to be done.
Hi, Michelle. Good morning, and good morning to the viewers of Newzroom Afrika. Yes, I don't think the statistics does anything to South Africans, truth be told, because the problem has been growing. The figures that you are reading has been going up. So I think I'm going to step a bit away from the statistics. Because the 21-22 statistics, if you could see the 2020 to 2021 when all of us were on lockdown level 5, those are the ones that will shock you a lot, because that was the first time we saw 9-year-olds being pregnant without anyone being able to say, no, the child was at school, because everybody was home with their own children. And that was the biggest number. There are more than 90,000. But let me come back. Social behavioral change, show me, we launched it in 2020, just like 5 days before COVID. We've been working on the program for 2 years. In 2020 March, we launched the program, and the impact is beginning to actually give us the results that we want. The provinces, districts are taking up the program, and we go in like district by district, because we've done all the provinces, we're now doing the districts. As you have seen on Saturday, we're doing Ekurhuleni. And obviously the program intends to try and say, please, children, let's go back to being children, let's go back to playing, but also teaching children to be resilient in whatever that they are doing through African.
Can I step in there? Sorry to interrupt you. I want to just take a step back for the sake of our viewers who perhaps might be learning of trauma for the first time. So tell us more about, you say the program was launched by the department in 2020 already. What was the objective? Yes. And I think you were getting to that just now. The objectives of the program is literally to address one of the issues already spoken about. It's to get children to be resilient. It's to get a different kind of a man in the future, because it's girls and boys, where we actually teach them everything from the dangers of alcohol and drugs, the dangers of sex and their own sexuality, the ability to speak out, to be heard and be seen, the issues around fatherlessness, the issues around the family and how they feel as part of the family, the issues around bullying and the impact it has, and a whole lot of other what we call social crimes, domestic violence, gender-based violence and femicide, how they support each other as children, how they relate to each other when others are pregnant, and what lessons can they learn from each other. That was the background. So it's like a buddy system, sort of keeping each other accountable in some ways, but also you have someone to go to if indeed you are in a situation where you might need help and you don't know who the appropriate adult is to go to. So we're there for each other. Yes, it's kind of like a buddy system with extra benefits in a way. But also it's creating a safe space for children. Yeah.
So as the chief Chomi, which is me, it's also about me ensuring that whatever I do every day, children can actually relate to it, and their responsibility to not do wrong things as the children's role model. It's also another aspect where I make sure that whether it's in my private space, children can also talk to Chomi, being the chief mascot of the Chomi program and the face of Chomi. That's also another way of politicians needing to be held accountable by children in the things that they do as their role models.
So if the children do, in the Chomi buddy system, if they do come across a challenge, what is the next step that they then take? Because obviously it's not something that they can address between themselves.
Our social workers, we've got specific social workers for our social behavioral change programs. And the social workers are attached to children. For an example, we're in Vosloorus on Saturday where we focused on children living in the hostels because they've been neglected for a very long time. We have 40 social workers that are facilitators of Chomi only. Not necessarily Chomi only, YOLO, Young YOLO, that's 10 to 14, 15 to 18, and 19 to 24. We've got social workers that are trained as facilitators and that do nothing but our social behavioral change programs. So we introduce them as well, and we make sure that they can interact with the children so that when I go to the next district, Chomi continues, Young YOLO continues, YOLO continues, so that we make sure the chain doesn't break.
Let me ask you this, Hendrietta. You said that the Chomi system was introduced in 2020, and I introduced this conversation by giving the latest statistics insofar as teenage pregnancy is concerned for the ages 10 to 19, and that number for 2021-22 is over 90,000. Is that an indicator that the programs that are in place in social development are not working?
No, it's not to say the programs are not working. That is why, Michelle, I started with saying when we were on lockdown level 5, we had more than 187,000 children between the ages of 9 and 14 that became pregnant in their own homes. If we take that and we take the statistics for 2021-2022, we wouldn't say the programs are not working, because remember 2020 to 2022 early, everybody looked at COVID. It became the biggest challenge. But even during COVID, we had online Chomi programs where we created a lot of online space for children to know every afternoon for 2 hours between 4 and 6, I'm going to have a space to speak to somebody that understands, where I can share my frustrations. And this is part of how we picked up a number of the children that fell pregnant in the home by one family member, whether it's the uncle, the father, the different men, even the siblings themselves made each other pregnant. Now, if you use that, you can't really say the programs are not working. What is not working in South Africa at the moment is the family. If we can get the family right, in whatever form, it will be the beginning of how we make these programs. The family system, it's totally dysfunctional.
Yeah, absolutely. It's never going to be down to the success of a government program only. Hendrietta, let me thank you for your time this morning. It certainly is an incredibly important discussion we're having this morning. Hendrietta Bogopane-Zulu is the Deputy Minister of Social Development. Thanks very much indeed for joining us.